Hi, this is Mark Struthers. Today we'd like to look at conflict resolution and communication in medical imaging. Effective communication at work is about how, when, and where you're communicating. Conflict in the workplace is about the disagreement between two or more people. The department with medical imaging not only interacts with most of the patients that come to the hospital or facility, but also most of the other workers within the hospital and facility, whether nurses, physicians, or other ancillary staff. So let's begin our exploration of medical imaging, conflict, and communication in the workplace. The overall objective of medical imaging is to acquire useful information that is utilized by healthcare professionals to provide patient care. As a medical imaging technologist, you have a great number of skills as well as in-depth knowledge. These skills include examination skills, technical skills, medical skills, and soft skills. Soft skills requires working with people of all ages and backgrounds. Key among these skills is empathy, communication, and attention to detail. You also need an even temperament when working with patients or other healthcare staff. The most successful medical imaging professionals need these traits. This graphic, which shows the top skills required for medical imaging job posting, demonstrates that communications and customer service are greater requirements than operations and management skill. The most common interaction for medical imaging technologists is with the patients. When patients present to the department, the person who is imaged is often in a vulnerable state and out of their comfort zone. It's the role of the medical imaging technologist to produce high-quality images and facilitate patient care throughout the imaging process. The patient experience when undergoing a high-technology imaging procedure is unique and diverse, and the patients are highly influenced by terms used, stories told, and symbols and mythology related to the exams that they're getting. The biggest myth is the danger of radiation exposure if the exams are done appropriately and properly. Medical imaging generates a unique interface between high-level technology and the patient and has been described as a human technical science. Medical imaging is generally equated to the old-fashioned radiology or clinical imaging stereotype. Today, medical imaging includes a wide variety of modalities that utilize imaging technique to look at the human body for diagnosis and treatment. These can range from the routine X-ray to the positron emission tomography scan with MRI, CT, and ultrasound in between. Because we have expanded the number of technologies that we utilize for medical imaging, we have also expanded the amount of interfaces that we have within the healthcare community, and this requires greater communication skills. The current healthcare environment demands effective communication and teamwork to reliably deliver the best quality patient care. The complexity of the teamwork and skills required can sometimes result in conflicts of interest. In order to provide safe and high-quality health care for the patients, the care professional should have an understanding of effective interprofessional communication. Effective communication between the staff will minimize or eliminate some of the conflicts of interest in patient care. Conflict can be described or defined as a state of serious opposition between two or more perspectives that influences the thinking and actions of the parties involved. There are a number of different disciplines that are required for patient care. Healthcare professionals may have different disciplinary perspectives that inform their understanding of a situation and may have a different problem or priority in terms of client care when confronting the same situation from their perspective. Unfortunately, conflict is significantly higher in the healthcare sector due to the multifaceted and regular interaction among healthcare professionals. It is assumed, and rightly so, that doctors are the head of the healthcare team in providing patient care. And while considerable attention has been paid to doctor-patient communication in the undergraduate medical curriculum, less attention has been paid to train the medical students on how to communicate with other professionals that they interact with in providing patient care. It is difficult for some physicians to realize that healthcare professionals perform the duties that they already know how to do and are trained to do. They do not need to be micromanaged by the physician. Obviously, the link between miscommunication and poor patient outcomes has been well documented in healthcare. Common areas of the hospital that report miscommunication are, obviously, the emergency services, the surgery suite, and the ICU. These are also areas that commonly use portable medical imaging, and the radiographer or medical imaging technologist has to interact with the surgery crew, the ICU nurses, and the emergency room staff. Often there is miscommunication about the prioritization of how medical imaging services are to be provided in these areas, the emergency room, surgery suite, and ICU. We know that failures in interprofessional teamwork and communication lead directly to compromised patient care, staff distress, tension, and inefficiency in patient care. With this in mind, we need to define the term tribalism as used in management, especially in healthcare management. Healthcare tribalism refers to the phenomenon through which different groups in a healthcare setting strictly adhere to their profession-based silo within which they exhibit stereotypical behaviors. Translation: when you go to surgery and are working with a surgeon doing medical imaging, you'll find that as the surgery starts to go south, you are in trouble. This type of behavior can lead to deleterious downstream effects upon productivity and care delivered to the patient. Well, we talk a lot about surgery, ICU, and nursing staff. Let's take a look at the medical imaging staff or radiographers. It appeared from a recent survey that radiographers who worked together well as a team and the profession-specific team was very efficient. However, when it came to working alongside other professional groups, there appeared to be territorial boundaries and different professions appeared to guard their territory. We can even break that down farther. Within the medical imaging department, are there tribalism traits between CT, ultrasound, diagnostic X-ray, positron emission tomography, oh yeah, and the day shift versus the night shift? Tribalism, or us versus them, is well known in the healthcare professional working environment. Tribalism is the behavior and attitudes that stem from strong loyalty to one's tribe or social group. When we think about tribalism, we're actually working against 6 psychological tendencies that human beings have. We tend to underestimate the harm we may cause others. We can also harbor biased beliefs from self-interest and the social dynamics of the work environment. Group self-interest also distorts a sense of what is right and what is wrong. One of the basic tenets of tribalism is the us versus them. This fosters the attitude that the individual is not as important as what matters to the group. Many times, different groups have different ethics about what is morally correct or right or wrong. Working in a stressful environment such as healthcare can increase the intensity of these tendencies in human beings. What do you think about this statement? Workplace cultures are likely to be influential in shaping behavior. Members of a team see their immediate coworkers and their part of the organization as special, alienating other people they do not work with directly. With the tribalism that exists in healthcare, it's easy to see that there are conflicts. There are a number of causes of these conflicts. One would be the differences in values and goals of the group. Two would be poor communication. And three, obviously, misunderstanding. Then we have personality clashes and stress, all of which happen in the healthcare setting. There's an old joke that looks at the observation the best hospital to work in would be one that was all computerized and robotized, and there would be one person working in this situation, and that would be the security guard who guards the entrance. Moral of the story is when you look at conflict, it typically exists when more than one employee is working. The hospital environment is complex and complicated. Hospitals are complex and complicated organizations, and they are prone to conflict. Within healthcare settings, stereotypes about doctors, nurses, and allied health professionals persist. For example, doctors can be viewed by others as strong leaders with high academic ability, but also having poor interpersonal skills. Nurses can be seen by others as hierarchical and rule-oriented, and allied health staff can be considered by others as passive political players and relatively powerless in the face of medical and nursing political structures. Conflicts typically arise due to interpersonal relationships, limited resources, change, organizational structure, and roles that are clearly not defined. Although we don't have a great deal of data on interdepartmental conflict, studies have shown that the effects of conflict on employees, patients, and companies also affects departments. Take a look at these two groups, clinical team and the medical imaging team. I bet you can probably put some labels on the different types of persons that are in each of these organizations. So let's look at the rest of the team. We'd have the department head or chief nurse. We would have the shift supervisor, and then we would have the nursing staff. Next we go to radiology, where we have the director of radiology, the shift supervisor, and the medical technologist. This usually makes up the us versus them teams for medical imaging and healthcare staff. Conflicts in healthcare are usually caused by poorly defined roles and hierarchical differences, as well as overlapping competencies and discrepancies in what is best for the patient care. I got your back looking at the medical imaging department, but you have to take a look at different groups. How about outpatients when you go to get them to do their examination? Are they watching you to see who went first and why? I bet they're looking at you not as good, but evil in not taking them first because they matter. The ability to trust and respect teammates is crucial in interprofessional collaboration in healthcare. If you listen to medical professionals and ask for their opinions, it is one way to demonstrate respect for your colleagues, although they may not be from your medical imaging department. It is also important that you share with them, and you are comfortable with sharing, your own observations and medical opinions. It would be great if we could communicate in the manner just described, but we work in a high workload, we have shortages of resources, and there's a lot of bureaucracy in healthcare. This is one of the main causes of organizational and personal conflict, is not having the time to work out solutions. There's always more patients and more procedures coming through the door. So we need to develop a communication skill set. We need a skill set for interprofessional communication or intra-professional communication, which would be collaboration within your own profession of medical imaging, or multi-professional, which would be professionals working alongside each other relatively and independently. Where do we find multi-professional situations? Well, let's see. The emergency room, surgery, and ICU. And where do we find conflict? Emergency room, surgery, and ICU. Some other reasons for conflict are the lack of knowledge about other healthcare providers and their roles and responsibilities. There are differences in their goals and your goals, and each of us has a different role in providing the patient health care. And also we have our professional values or our scope of practice, which is such as medical imaging, nursing, or being a physician. For the last part of the presentation, let's just look at some overall sources of conflict within any organization, especially healthcare. Again, thanks for watching, and if you're interested in more presentations on medical imaging and healthcare, you can look on my YouTube channel, Mark Struthers.